Well, I am a competitive cheerleader. I also teach as well, teach children all over the nation, so we do clinics and stuff like that, teaching the sport. And I specifically, in the sport of cheerleading, am known as a base or a stunner, and I co-ed stunt. So everything I do is throwing of flyers into the air, and a lot of that brings a lot of impact on our shoulders. So that impact is what brought me in here today, because I've due to the sport, I've been living with an injury for about 4 years. So my body's a little fired up at the moment, and I'm just trying to find a way to get back to being normal and get back to my old self and get my strength to where it was so I can get back in the game.
So I finished my medical studies in 1992, so I've been in medicine a little over 3 decades. Regenerative medicine is a subspecialty of medicine that we are trying to harness innate healing potential of the body to heal diseased or injured tissues. It's compared to traditional treatment. It is mostly focused on restoration of structure and function and returning patient to normal life.
Cheerleading has become my life through the sport, and me having this injury, it takes a lot from me because I'm on more of the physical end of getting these girls in the air and teaching them and being able to show them instead of just talking to them. Let them actually physically feel what they need to do and teach them as well. So me being injured takes away from that ability to give them that knowledge and give them that extra step in one-on-one lessons and learning when it comes to teaching cheerleading.
PRF, or it's an acronym for Platelet-Rich Fibrin. It's a blood-derived biological material. It is 100% derived from patient blood. It's a concentrate of human platelets. It is considered second-generation biological or platelet concentrate that overcomes most limitation of its predecessors, such as platelet-rich plasma, or known as a PRP or PRFM. It is, compared to other predecessors, PRF is completely natural. It's 100% free of any chemicals or any additives. It's completely from the patient blood, so it eliminates issues like allergic reaction, immune system rejections, or any other problems with the predecessors.
So before I got into cheerleading, I was a football player, and I actually had a labrum repair on my shoulder. So I've been through surgery. I know what surgery feels like and the extensiveness of it and the length it takes to recover from surgery, and anything but surgery is the best option. I've tried cortisones, I've tried all these steroids and stuff like that, and nothing seemed to help. It was more of like a band-aid, and I want a permanent solution, and I've done a lot of research and gained a lot of information on this PRF injection. So I'm very excited about it, and I just want to get back to my old self, and I believe Dr. Talac can get me there.
PRF right now is close to ideal biologic material because it almost exactly mimics a microenvironment of injured tissue. So when we use it, PRF allow us to stimulate innate healing potential, and also it contain almost exact proportion of cells, growth factors, and other materials as natural body. So this is very important for incorporation of this biomaterial and promoting healing.
So the procedure went smoother than I actually anticipated. Dr. Talac was very informative with how things were going to go, and then through the process it was easy. I didn't feel no pain. It was just a quick drawing of blood and spin it and re-inject it, and it was simple as that. It took no less than not even 2 minutes to do between both injection and drawing of the blood. So it was really quick. I think what comes next after the initial process is what matters most, and that's the recovery, and that's the putting time into rebuilding and restructuring and getting healthy and doing what needs to do to take this all the way.
I believe that once you come to our clinic, you will never look at patient care same, because we have really spent a lot of time and effort to make this care and our experience for our patient really personal. We really focus on entire patient because we need to team up with other patient to engage in regeneration and recovery. So I would be happy to help any patient they feel they would like to see different alternative to traditional treatment.